Dr. Norton, appreciate your time. What is your reaction to the UK moving to get this vaccine to its people so quickly?
Well, I think they're in different conditions than we are here in Australia. So it's under pandemic conditions, emergency measures, but I am still concerned that it's very, very fast. And certainly I'm looking to see what evidence they've gone through, or they've just taken the evidence directly from the manufacturer.
And the Australian government has responded and said that their timeline for a vaccine rollout, subject to approval, still remains next year. So do you think that that is still the right strategy?
I definitely do. I think, first of all, there's the logistic chain. It's a different context, a much larger, more spread out country. And nothing wrong in a way. We are in a different position in the pandemic than the UK or the US are. And therefore, for us to wait a while to see the results from those countries that emerges. And even for the phase 3 trials that are still going on, despite this new discussion, there are still elements of the phase 3 trial that is still ongoing. We need to watch the safety, but also the longer term effects and the longer term efficacy of the vaccine.
Absolutely. And I guess the world is now waiting for this vaccine to try and get to some sort of a COVID normal. What will the impact of a vaccine mean for countries?
Well, the first thing I think everybody needs to remember is it's not going to be instant. It's going to take 2 doses. It's going to take some time for that immunity to grow, so at least a month for that immunity to grow after your second dose. So first a few weeks and then a second dose. The second is that we won't lose the normal public health response pillars, if you like, the hand hygiene, the physical distancing, and the disinfection and environmental cleaning and contact tracing. All of those will be with us for here in Australia until at least Q3, even into Q4, because it's not about the first or second or third groups of vaccinated people. It's when the population is vaccinated, particularly when we get past about 65% of people showing immunity.
Now, you've led World Health Organization responses to Ebola and measles outbreaks. How has Australia's response to this outbreak compared to those?
Well, we've done an amazing job. I think certainly the leaders from the Departments of Health in federal and state and territory governments need to be congratulated, particularly for their early responses. I think that's been extremely strong, well founded on evidence and science and a medical requirement. There was, I think, a drift. Everybody's aware of it between states and territories. It's the same virus throughout the last few months, and yet for a while it looked like we were fighting a different type of virus in different states. But on the whole, absolutely, it's a beacon amongst other countries. Just to look to the north, into the northern hemisphere, and I suppose the devastation that's occurring at the moment. I think we're still only a few mistakes away from being in a similar position. We should not let up our guard at all. We still have some way to go. We have never seen a pandemic end in less than 2 to 3 years. And I really can't see any difference here. So Australia is in a great position. We unfortunately will have to defend, if you like, that quarantine and that border control for some time. But when it comes to vaccination, remember that the world is only planning to have about 20% of the entire world's population vaccinated by the end of next year. So there's a long way to go.
And how can Australia go about managing its border situation? There's thousands of Australians still stranded overseas. How big of a threat do returning travellers pose to the management of the pandemic here?
Well, it's one of our key first lines of defence, but I think we can do more. Protocols are only so good. And we saw that in South Australia. We've seen this occur now in Sydney with the latest breach, if you like. And that is not down to any one particular individual's mistake or whatever. You can have a system that's in place. What we've been calling for, actually, through our group as well, is to look at other tools. There are tools being used in other countries. For example, recurrent testing of all quarantine staff twice a week. The math tells us that with an incubation period of 4 days, we need to recurrently test people who are on the front lines. And these brave people who are working in quarantine centres are on the front lines for us. I think a 1 weekly test is not enough. I think we need to move to twice a week and then look at other forms of testing like antigen as well as PCR testing.
Why is Australia starting late then to this sort of rapid testing?
Well, first, historically, we've always been a little averse to that form of point-of-care testing. It's been always a system in Australia where we take all all tests down to the laboratory and have them done there and then brought back to the clinical area. A lot of other countries don't work in exactly that way. It's about 15 to 20 years of discussion on this. I think in this case, this could be a bit like telehealth. We saw a huge jump forward in that. I feel that we should be looking at the same for point of care testing like antigen, where it can be turned around in 10 or 15 minutes and give you a result that at the moment is now showing in other countries, UK, US and Europe, up to 90% efficacy compared with PCR. If you do it often enough, then the actual balance out is about equal.
Fingers crossed till we get to that stage. Dr. Ian Norton, appreciate your time. Thanks for joining me.
Thank you.